Hi, I'm Dr. David Morris with Magnolia Medical Center here in Murfreesboro, Tennessee. Today I want to go over with you a very important concept when it comes to being healthy in this country. Our healthcare costs in this country are out of control. And if you want to truly be healthy, this is a concept that I truly believe you need to understand. Okay? So first off, we're going to give you an analogy. Okay? The analogy is you have a glass of water and you go to take a drink of it and it tastes horribly. Okay? So that's like your body not working right. So glass of water, your body, health problem. Okay? Same thing. So here's your glass of water. In traditional medicine, in Western medicine, if you had this glass of water and it tasted poorly, there's a few options as healthcare providers in Western medicine that we have for you. We could flavor the water. Okay? So that's an option. You could say, all right, well now it tastes good. You need the water. You're thirsty. You need the water. You want the water. So we could provide some flavoring for that water to make it more palatable. Now, another option that we have is we can give you some sort of prescription that would make your taste buds so that you couldn't feel or taste the water. Like, we know that this is the case. We say, well, we're going to give you medication so you don't feel the headache or so that you don't feel the back pain without looking for the underlying problem. So we can give you a prescription for it. Now, let's say that doesn't work. Another option we have for you is why don't we do some sort of surgery or a procedure to the nerves that go to your tongue so you don't taste the water. Now, none of these things really make sense to you, but let's face it, those are the options, right? That's traditional medical care. Now, there's one other thing that we can do is you say, in medicine we could say, all right, well, let's test the water and find out what's wrong with it. So we test it and we find out that it's polluted, so we look backwards and we say, well, where did we get the water? And in this analogy, we got it from the reservoir. You know, we pulled the water out of the reservoir, through our pipes, we filtered a little bit, but it's still polluted. So what we can do is we can come over here and we can treat the water in the reservoir. I got to ask you, does that solve the problem? So far, have we solved any of the problems? And the truth of the matter is, we have not solved any of the problems, okay? Because this is all downstream. Now, when you think about this for a second, if we had a polluted reservoir, the question that we should be asking is, how did it get polluted? All right? If we have this bad tasting water over here that came from this reservoir and it's polluted, how did it get polluted? An upstream approach would be able to would say, let's look up the creek here, or the river, and find out what is polluting the water. And if we solve that, let's say we found this factory that's dumping a bunch of garbage into the water, and we solved that, then we permanently fix the problem. That is not what traditional medicine does. Traditional medicine, well, I'm going to back up here. Which costs more? The upstream approach at looking for the cause, or the downstream approach, which is treating the problem down at the other end? Which costs more? Now I'll tell you, when I ask that question, I normally get a 50-50 response. 50% of the people say upstream costs more, 50% of the people say downstream costs more. But here's the question. Which problem fixes it permanently? That one, the upstream approach. So this never, ever, ever ends. Okay? This solution never ends. So it ends up costing way more to do a downstream approach. Make sense? Okay, now, what we do here at Magnolia Medical is we're always going to look for that upstream approach, right? And if you're going to a doctor that's not looking for the initial cause of the problem, you're never going to solve it. You're never going to solve it. Your health problem is going to stay there. You're going to have to manage it forever and ever and ever. So if you're looking for an upstream approach, find somebody like us, Magnolia Medical, or find somebody who's going to look for the cause of the problem. But we want you to be healthy. Please do me a favor, share this with your friends. Click the like button. It's probably going to show up somewhere on your screen below here. Hit that like button. Subscribe to our YouTube channel. It would really help us get the word out about what true health is. Thanks for watching. Have a great day.